All right, so everybody wants to know about Simon Cowell. How do we go from here to here? Now, he's definitely had something done. He's actually come around to the fact that he's admitting that he gets Botox and fillers, but he tries to say, hey, that's it. That's all I've had done. And I don't think that that's true, and let's talk about why. And this is one of those, a picture's worth 1,000. This is Simon Cowell before, right? Now I want you to look at where his eyelid, his lower eyelid goes to his actual sort of eye itself, and you'll see that you don't see any white or what we call scleral show around his iris. You don't see it. Move over here post, and you can see this. You see how we're starting to see how far down this lid's kind of coming, and we're starting to see more of the sort of white of his eye, or this what we call scleral show. Now, this in itself is not a sort of shocking change because you will see a little bit of this as we age. As we age, we lose our fat pads from our sort of what we call our cheek or orbital fat, and we're going to get a natural sort of drop. But when we see a degree of scleral show like this, where you can follow this white sclera all the way around, we get that from really only one way. And that is when we get a complication from a blepharoplasty, specifically a lower lid blepharoplasty, a subciliary lower lid blepharoplasty. Now, one of the things I really want you to pay attention to is the scleral show in conjunction with what we call the cheek and the midface. So you can see we've got really what we call low descent of this cheek in midface. It's way down here. And we don't have a lot of volume here. This is what we call the lid cheek. Now, we can fix scleral show like this in one of two ways. The first way is we actually put a skin graft. That works, but it's not the most aesthetic way. The second way that we can do it is we can actually overfill this cheek and actually lift the midface up, either both surgically or just with volume, to push this cheek up, which can then actually start to lift that lower lid lag and actually decrease that scleral show. But how much filler would you need if you had this much scleral show after this lower eyelid lift? And the answer is you need a lot. So you can actually see all this volume actually moving from here along the sort of nasal sidewall, lower lid base to the cheek junction itself. And you can see how much volume is required to push that eyelid back up. Now, the second thing that we see that we just absolutely know is plastic surgery is we can actually see the eyebrows themselves. So I want you to see this. This is a very masculine looking eyebrow that you see here, which most men just naturally have a flat eyebrow. So how do you go from a flat eyebrow to this sort of peaked look? Now, Botox can cause your eyebrow to pull, but it's actually going to release the sort of eye muscles themselves, so it goes around your orbicular oculi muscles, and which is going to just push it so the whole thing goes up. But when we get an arch, specifically like this, only one way that happens. That's surgery, baby.